This month's topic is about allergies, and an allergy is when the immune system has learned that something is an enemy and attacks it, which produces an inflammatory response. Now, some of us are already set up for inflammation, and others have more, if you like, resilience or resistance. So there are two parts of the equation. One is how to reduce your exposure to the substances that you are reacting to, and of course how to find out what they are. And the other is how to reduce your system's inflammatory potential. So, for example, I've got a question here from Cheryl from Brussels, and she reacts every year to birch tree pollen. Now, silver birch tree, there's not much she can do about it. I mean, last year she left the country for a month, but she can't do that every year. So the question is, how can she strengthen her immune system, reduce that inflammatory potential? Now, there are two parts to this. Number one, it may not be that that is the only thing, Cheryl, that you react to. Very often there are also hidden food allergies, and all of these, it's like the sort of total load. So if you find out what you're allergic to in relation to foods and get them out the way, then the only offending item is the silver birch tree pollen, which of course is hard to avoid. Now, the other side of the equation is that you can improve your body's reaction to inflammation with 5 nutrients. And these are quercetin, which is very rich in red onions. There's also some in cranberries and apples. However, a red onion will give you 20 milligrams. I like to supplement over 500 milligrams. So we are talking about 20 red onions worth. Quercetin is good. MSM, which is a form of sulfur, is excellent. Vitamin C is very important because it's a natural antihistamine, and a lot of reactions, for example, to hay fever, involve histamine. So if you can up your vitamin C intake to 2 or 3 grams a day, that makes a big difference. The fourth is glutamine, and glutamine actually strengthens the lung tissue, so in a sense it stops things getting through, such as pollen, and it also strengthens the gut. And sometimes what happens in food allergy is that people are drinking too much alcohol, which irritates the gut, or taking anti-inflammatory drugs, painkillers like ibuprofen for example, or antibiotics. And when the gut wall becomes more leaky, then foods can get through. So another lady, Sandra, she's asking about how can I sort of hay fever proof my son. Now, I find it very interesting that the 3 most common things that people react to are milk, grass pollen, and also wheat. So what have they got in common? Now, this is just a theory, but of course grass pollen, it's a grass, wheat is a grass, and milk is made from grass. And I've found that a lot of people during the hay fever season, if they limit or ideally avoid completely all wheat and all dairy products, often their reaction becomes much, much less. If you also supplement a formula containing quercetin, MSM, vitamin C, glutamine, and the last favourite nutrient is bromelain, so you can get combinations of those 5, that really reduces inflammatory potential. Now, another lady, Michelle from Cork in Ireland, she gets peeling on the inside of her ears, and they also get very itchy, and she's wondering if that is an allergy, and it certainly could be. An allergic reaction is inflammation, so normally there's redness, itchiness, swelling. So for example, in eczema, the skin becomes, red and itchy, and again can peel. So these are classic inflammatory reactions, producing more mucus, so getting sinus problems. This is also a classic sign, and a lot of people who have allergies, they're always wiping their nose. We call this the allergic salute, by the way, because they've got this constant nasal irritation. So how do you find out what you're allergic to? Well, there are 2 kinds of allergy. One is called IgE. It's based on an antibody called IgE, and this kind of reaction causes a very immediate reaction. So this is throwing up after eating shellfish, or a violent reaction to peanuts. But most allergies, most food allergies anyway, involve another antibody called IgG. And you can get from a pinprick of blood a test which is called a quantitative IgG ELISA test. ELISA is the best technology. Quantitative means it's going to tell you the scale of your reaction to foods. And the laboratory I like the most for this is called yorktest.com. So find out what you're allergic to, remove them. By the way, IgG allergies do not last for life, so 3 to 4 months, removing as much as you possibly can all your allergens. Boost your immune system and your inflammatory response with those 5 nutrients. Remember, vitamin C is very, very important. And then you may find that your allergic tendency reduces right down and your symptoms go away and you feel much better. Looking forward to hearing from you next month on Ask Patrick.